Alright, a lot of you are probably wondering, well, STI, STD, what the heck is the difference? And I mean, both terms can be used and it means pretty much the same thing. If you have an STI, you have a sexually transmitted infection. This occurs when people are infected but may not show the symptoms, or it might not develop into a disease. So an infection is less catastrophic, I would say, than a disease. You, however, are still contagious and carry the potential of developing into a disease. An STI can mean more than a visit to just a doctor's office and getting an antibiotic. 4 in 10 sexually active teen girls on average have an STI that can cause infertility and even death. That's kind of cut off on the bottom there. But versus if you have a full-blown STD, it occurs when the STI progresses in the body and results in a disease. So again, the STI is usually, you're not really showing symptoms yet. But if you are, again, being sexually active, have multiple partners, not using protection, it's a good idea to always get tested so they can cure it as soon as it pops up. If it is a bacteria, we can get rid of it and treat it. If it's a virus, we cannot. So this occurs, again, when an STI progresses in the body and you have a disease. Teens between the ages of 15 and 24 only represent 1/4 of the sexually active population, but just that small sexually active group of people account for almost 50% of the 18.9 million new cases of STIs each year. Again, we can assume that this age group is having more sexual partners, maybe making rash decisions about sleeping with people, not talking about it, not using protection all the time, not getting tested. More drugs and alcohol are involved, maybe. We just assume that the younger generation are a little more immature to deal with talking about STDs, STIs, avoiding pregnancy, and they just kind of assume, oh, it won't happen to me, and they're just out there doing it. Not saying that that's everybody in that age group of 15 to 24, but we can agree that that higher population is making probably not as calculated of decisions. So if you have a sexually transmitted infection, that means you're just infected with something. However, if the infection itself develops into the body to the point where you are, suffering daily with these symptoms, or your STI led to HIV, then you could have an STD. But STD, STI almost can be used in every occurrence when talking about them. It just depends how bad they have progressed in the body. We did this in class, so you guys don't have to worry about it. We made posters just quickly, well, some of us quicker than others, about the STDs, but I told you about all of them, so you're good to go. How STDs are spread. There's a lot of people that think it's just by sex, but that's not. I'd say the most common way it is spread is through sexual contact, yes. But you can also have it through blood-to-blood contact, which is why it's super important to wear gloves when handling anybody's blood during first aid. Mother can pass it to baby through breast milk or even in the womb at some instances. And then sharing IV needles, again, the blood-to-blood contact, having contaminated needle, shoving it into your arm, things like that. How they are not spread. They are not spread by casual contact, such as kissing or touching, unless we're talking about, herpes on the mouth, then you can get that through kissing. But you can't get, AIDS if you're kissing someone unless their mouth is bleeding and your mouth is also has an open wound on it. So That's why we're saying casual, just like everyday kissing, you probably won't get AIDS from that. It is not spread by sharing basic things like pencils, books, or restrooms, public toilets, things like that. Back in the day, people thought you could get gonorrhea from a public toilet seat. It turns out you cannot. The biggest thing is, again, in some instances, like herpes, like possibly sharing a toothbrush and things like that, some personal items, but basic items like pencils, books, you're not going to get an STD from. Other germs and bacteria, perhaps, like the cold or the flu. It is not spread by donating blood. They do a lot of checking and testing before using people's blood. So they would make sure that you are not getting any sort of STD or HIV and AIDS through blood if you were donating or receiving someone's blood. And all the equipment they use is very sterile. And it's not spread by insect bites. There are other diseases that are spread through like mosquitoes and ticks, but STDs and STIs is not one of them. STDs and pregnancy, again, we talked about this a little, but chlamydia or pelvic inflammatory disease, which chlamydia can develop into, can cause fallopian tube infection, permanently damage them, the uterus, surrounding tissues, leading to infertility. Herpes can infect your baby at birth and then infect it to have herpes the rest of its life. A baby born to a mother with an active infection of gonorrhea can infect the baby with blindness, joint infection, or lifelong blood infections. Genital warts can grow large enough to cause the birth canal to become blocked, and a C-section would need to be performed. All STDs can cause different complications, including miscarriages or premature births. So they do a screening if you become pregnant to make sure that you are STD-free, because they need to know what they're going up against when trying to bring this baby into the world. Again, this is a silent epidemic. There are approximately 20 million new cases of STIs in the United States each year. About half of those occur in people between the ages of 15 and 24. So again, that age range is mostly to thank for spreading these STIs around. Harmful effects, physical and emotional suffering, yearly healthcare expenses that amount well over $10 billion. In short term, they can cause you pain, discomfort, and obviously some embarrassment to have to tell someone that you have been infected with an STD. And you have to be careful when you're having sex with them. In long term, it increases the risk of getting certain cancers and becoming infertile for both men and women. Many can be treated with medicines, but again, those viruses are incurable. You will be with them for the rest of your life. If left untreated, some are even fatal. For example, HIV and AIDS or genital warts. You do not build up an immunity to STDs after you have been infected. It's not like other communicable diseases. STDs are unique in this way. So if I get the cold or if I get my shot for COVID, I build up some sort of immunity to it. That doesn't happen with STDs after you get them. So especially the bacterial ones, I can cure gonorrhea and chlamydia, but I can still get them again after I've already gotten them. So again, a cured person can be reinfected later by the same STD. The only ones that we have vaccines for, again, we can do this for viruses, but most of them, we don't have a vaccine for them. But the hepatitis C, there's a vaccine to lower your risk of getting it, and the HPV. But again, we're not going to build up an immunity to an STD after we have been infected. Risky behaviors of this silent epidemic. Ignoring the risks, obviously, just having unprotected sex, having as many partners as you want, and not worrying about getting it. Having multiple partners, again, and not seeking treatment. So if you think there is something wrong and you're embarrassed and you just kind of push it under the rug, the chances of it getting worse are very, very good. Avoiding STIs, you obviously need to practice abstinence. That is the only 100% way that we can guarantee that none of this is being passed to you. The only other way you can guarantee it is if you know you had one sexual partner and your partner had one sexual partner and you were both recently tested and you're both clean. That's about it. Avoid drugs. Obviously, you can also get some of these STDs, STIs by sharing needles, but also drugs happen to affect our decision-making skills and hinder our ability to make good ones, so that could lead to something. And choosing responsible friends, not hanging out with people that are making poor decisions that might spread STIs to you or other people. Excuse me. And then, of course, we need to remember our refusal skills. You are allowed to say no at any time. Anytime you say no, it should stop. So, again, say no in a firm voice. Tell them why not. Offer an alternative idea or activity. And P, promptly leave if you are hopefully able to, circumstances bearing. But this last video I'll post on there for you talks about consent. It's super important to have, regardless of, you know, any crazy laws Minnesota is coming up with right now that might make me want to cry. But, you know, if a person says no at any time, you have to stop. They might change their minds. They might, you know, one day want to have sex and the next day they don't. So this video puts it into really great perspective, and it compares consent to drinking a cup of tea. But other than that, that is how our sexuality unit will end. And hopefully you learned something or multiple things to carry with you on your young adolescent journey. Obviously, biggest thing is abstinence. That's going to be your friend for as long as you can have it. Otherwise, are you making good decisions to prevent pregnancies, STDs? And what are you doing to make sure that you have consent? Feel free to, again, reach out and ask me if you have any questions or concerns. You know, anytime something pops up, I'm here to talk to you guys. Use me as a resource. You know, have open conversations with your parents about sex. It shouldn't be this awkward thing that nobody talks about. I think that's the biggest problem. Why, again, we have all these unwanted pregnancies and STIs and STDs spreading because no one's talking about it. And we're all kind of like, hush, hush, we shouldn't talk. But hopefully now, with your understanding of how your reproductive systems work separate, and how to keep them healthy and how they work together, you can make some more informed decisions as you move on in your adolescent lives. And again, I hope you're making smart decisions, but that's up to you.